Great question. Believe it or not, I've been following ECC for almost 10 years just through social media. I've attended twice online from Canada, and I attended during the pandemic. It was a great source of continuing medical education. And I always thought, I need to eventually get there as an in-person attendee as well. So when I got the invitation this year to come and speak, I was really excited to come and speak at the meeting and be a part of the meeting. Yeah, so rectal cancer is becoming increasingly complicated in treatment. We have so many different options, and because of the so many different options, sometimes people don't know what to do with all of the evidence. There's studies coming from all over the world in all different modalities of treatment for rectal cancer. So what we decided to do back in 2021 as our group was to try to come up with an algorithm that simplifies the situation, simplifies what are the best sources of information from each of the studies that are being produced, and how can we put that data together to create a patient-centered, tumor-specific algorithm for the treatment of rectal cancer. So we included contributors from surgical oncology, colorectal surgery, medical and radiation oncology, radiology, pathology, and also some patient partners. And we came together completely as a group and put together an algorithm that we use on a routine basis weekly in our tumor boards. Oh, honestly, that's a loaded question because there's just so much to look forward to. It's been a great experience, and I'm looking forward to even the next couple of days, the next 2-3 days with the various high-level talks. Because the talks are not, you're noticing that they're not general topics. They're specific topics in specific areas of colorectal surgery. So they're targeting the specialist colorectal practitioner. It's not targeting the general practitioner. So by the level of the talks, the high-level questions that are being asked, also from the audience. So all of these things are things that I'm looking forward to. But in addition to that, the collegiality, the meeting of colleagues and people I knew on Twitter and LinkedIn, I'm now meeting in person. So it's a great opportunity for the social environment as well. I've been very fortunate that I've met a lot of the legends at other meetings as well. I'm just looking forward to reconnecting with a lot of them. To be honest with you, one of the people I've never met was Walter Brunner. So I just met him yesterday. It was great to actually meet him and Dieter Hanholzer. So I've actually never met them in person. It's great to finally meet them in person. So all around, just looking forward to connecting with everybody at this meeting. Absolutely, without a question, that's a huge part of progress and of personal progress as well. I could tell you, we have our congresses in Toronto. That when we hold a congress, the reason we're able to invite people to our congress is because when you meet them at congresses like this one. So it has long-lasting benefits, both from a professional standpoint and honestly from a social standpoint as well. It's extremely important, honestly, stay humble and keep learning. We don't know everything. I've been in practice for 11 years, 12 years almost, and I'm still at the tip of the iceberg of learning. I reach out to senior colleagues. I'm open. I learn from my junior colleagues. Experiences are so important in our way of working. You cannot learn everything from a textbook, from papers, from the internet. You need the experience as well. And sometimes a junior colleague has the experience that a senior colleague might not have ever experienced. So just being open to learning from anyone, and learning from your patients as well. Keep your ears and eyes open with your patients, because they will tell you what they're suffering from. They will tell you what they've experienced, and you can learn from them to help your subsequent patients as well. I would say, different phases of my career have had different highlights and transitions. Earlier in my career, I was really interested in trying to push the limitations of laparoscopy and trying to travel as much as I can to meet new people and learn more from different congresses, just as an attendee, not as a speaker. Later in the career, I started to push my research a little bit more, push a lot of our trials a little bit more. At the present time, I've been doing a lot more robotic surgery now, and I'm trying to push some limitations of what we can do robotically, so robotic multivisceral resections, with and without colleagues in other specialties, learning from them honestly what they do and how I can transition that to what I do in colorectal surgery and surgical oncology. So it's where I am now. I would say I'm trying to even push the boundaries from a robotic, minimally invasive perspective in multivisceral resections.